I've always been interested in microscopy and also diversity of illness and disease. And pathology is fantastic in that sense, in that it allows you to cover a very broad scope of diseases and health conditions, while also allowing people the option to subspecialize and develop particular interests in areas, particularly in oncology. When implementing something new like digital pathology, I think it's worth to actually take a step back and realize that for well over 100 years, the practice of pathology has involved a paradigm with glass slides and a light microscope. And when you introduce digital pathology, so taking the glass slides and making digital replicas of them that are examined with software and on a high-resolution monitor, it's much more difficult than it sounds. I think that's probably the biggest challenge that most labs would be financial, and then the implementation and the disruption that goes with it. But Mackenzie Health has been in collaboration with Philips as part of our long-standing partnership. That's where this particular working relationship has been, I think, exceptional. That's one thing where Philips, I think, has been very helpful, is by being so responsive. When we have had issues arise, we have these bi-monthly calls. Even if something were to come up that was of a critical nature in between those calls, we have a representative on site who can escalate things up very quickly. Pathologists who for sure are quite leery of this technology, and particularly of artificial intelligence. And the fear is largely that pathologists would be replaced by larger groups, and that's not really true, because there's so much work to be done that a group of pathologists in the downtown of Toronto can't handle all of that work by themselves. There would always have to be some type of human fallback. And I think going forward, the role of the human in that as the ultimate chaperone of the whole process will most likely change, but it's not going to disappear.